Okay, so I'm going to go over the skill with you. We're going to start by entering the room and performing our AID-IT. I'm going to skip through that a little bit. Hopefully by this point you already know how to do AID-IT, and we're going to go right into the skill, but I just want to show you a couple things before we get there. So, knocking, entering into my room. Obviously I need my table and my equipment. In order to perform trach care on our patients, we're going to need a tracheostomy care kit. The trach care kits, as you can see here, just like I've been telling you right along, you need to make sure that you read the label on the kit. It will tell you exactly what's in the kit and what you still need. This is really important because some kits actually have things in it already, like the peroxide and the sterile water, versus other kits that might not even have sterile gloves in them. So you just need to read the kit so that you can assemble all the proper equipment. This kit has everything we need except for the peroxide and sterile water. So I have a bottle of sterile water and a bottle of peroxide. These are brand new bottles and haven't been opened yet today. So when I open them, I'm going to make sure I date, time, and initial those. Remember, fluids are only good for 24 hours.
So Ms. Power, can you use normal saline, sterile saline?
No, you only want to use sterile water with this procedure.
Oh, okay.
Yes. And reminding you here, student Katie, that fluids are only good for 24 hours. Once they've been opened, you need to make sure you lip the bottle, which we've already discussed. But today they're brand new, so I won't be needing to lip them today. I'm also going to make sure I arrange my environment. So I'm going to make sure the bed is up, which it already is. The side rail is down so I can get to the patient. I'm not leaning over the side rail. And then I have my table in a good position. The table should be at the head of the bed so that I'm not turning my back on my sterile field as I'm grabbing items. I can just move in an orderly fashion like so. Let's look at the patient for a second. So, student Katie, I just want you to see right off the bat, your patient has this device over him here. This is actually going to be providing the patient either with humidification or oxygen. So this is called a Trach Collar.
Okay.
It's hooked up to the oxygen, or again, hooked up to humidification, and we're going to need to move this out of the way. Now, if your patient requires oxygen, you don't want to leave this off of them for an extended period of time. So make sure you put it back.
Okay.
The other thing that you need to note when you're looking at your patient is the size of the trach. There are different types of trachs. There are metal trachs and there are plastic trachs. Today we're using a metal trach. And it's really hard to see on camera, but you can see right there by this piece, there's a number 7.
Oh, okay. That makes it really easy to know what
so
size
that's
I'm
a size 7. Okay, so those are just a couple things to observe before you even get into the room, or before you even get into the skill, excuse me.
Okay, so what are some reasons that my patient with a trach, why would we need to do trach care?
So Ms. KMB talked a lot about this in respiratory when she was talking to you about the need to do trach care and suctioning on a patient. We always want to perform suctioning first on a patient before we perform trach care. Trach care really needs to be done minimally once a day, but if the patient has been suctioned and they still appear to be mucousy or they're struggling, we might want to pull out that inner cannula just to see whether or not there's something clogged in there and kind of clean it off from there.
Okay, great.
So suctioning really should be done prior to trach care, and that is going to be important for you. Oops. The other thing I just want to show you real quick is how the trach care works. So it has an outer cannula, you can see it, and then inside it's got what we call an inner cannula. You get to the inner cannula by moving this little device here and then pulling it out. So this is the part we're cleaning. This is the part that's going to stay in the patient. So So that's important. Each different metal trach has a different type of locking mechanism, so you're going to want to make sure that you look at your trach and determine how it unlocks and locks. And then you can see the two ends there hold our trach ties. So I'm just going to slide that back in, and we'll do trach ties at the end. Oops. This is not an easy thing to do. I will show you guys a trick.
If you feel like you're all thumbs and you have a difficulty with putting a trach tie on, is it okay to ask for help from your instructor or another nurse?
Absolutely. You would definitely want to get some help. There should always be somebody in there to help you with trach ties because the only thing holding the trach in is the trach ties. So you definitely want somebody to hold on to it while you remove the ties and replace them. So, okay, so let's get to the procedure then. Of course, I've washed my hands. I've done it. Remember, this is a skill, so we need to make sure that we have an order. We've checked name, date of birth before we proceed with that. Now, because I've already suctioned the patient, I would have a mask on. So for the purposes of being able to explain in the video, I'm going to not wear a mask, but remember from your suction video that you should have a face mask and face shield still on while you do trach care. Now, it's least likely that you're going to be hit with any secretions from trach care versus suctioning, but you still should wear it just as a precaution. Okay, and I'm also going to put my table here, guys, just so you can see what I have on my table and how I open my things. But remember, the table should be at the head of the bed. So let's begin by opening our tracheostomy care tray. So remember, when you open things, just like Miss Blackmore taught you, we need to make sure that we open away from us and open very carefully. So very carefully opening away. Oops. Tucking under, and then all of my items are exposed here. Now, what we're going to have you do is we're going to actually have you pull out the sterile gloves and put them on this sterile drape. And that's because we don't want you to touch the gloves as much as you would before. None of that makes even any sense.
So they're sterile gloves, so we just want to make sure that we are able to open them without contaminating. So that's what our paper barrier does.
Yes. Thanks, Miss Camby. Okay, so we're going to pull out this drape here. Now remember, it's just like that game Operation. We don't want to touch anything inside here or it's going to be contaminated. So when we reach in, we have to make sure that we don't hit our fingers on any of the edges of this container. Everything in here is sterile, so we just have to be very careful. And we're going to reach in and grab this by the corner. And then, just like Miss Blackmore taught us, we're going to open this up using our 1-inch border. Very carefully. Opening, opening, opening. And I'm just going to kind of move around to open it on this side as well. And then I'm going to set it down shiny side. I'm going to take one of my gloves by the cuff. Lay it out. Other glove, remember, you need to grab them from the cuff and lay it out.
So now, Miss Palmer, this is really no different than when we put on our other sterile gloves, right? Because we have our giant area that has the 1-inch border that we can't touch around.
Absolutely. Okay. It's going to work exactly like when we had our gloves in a package. And it's going to be a little bit easier for us since we're using this. We even have a little bit more room here. So just make sure you're opening that very carefully, only utilizing the border, and then gently setting your gloves down, only touching the gloves cuffs. Remember, the cuffs are the dirty part, so it's okay that we touch them. The fingers are the part that need to remain sterile. So, and then we're gonna set up our equipment over here, and we have two dishes, if you will. We have one that has a tab on it, and the other that's the actual case here. So we're gonna take this tab and pull this out, and then set it aside. Everything inside here is going to stay sterile. So we just have to be careful about touching it. And now we're going to add our solutions. So we're going to do half peroxide. Remember, palm, label, lip if necessary, keeping my hands above my waists and not going over any of my sterile fields. I'm going to go ahead and pour my peroxide. The peroxide goes in the bigger dish, half of it. Then the sterile water, again, palming the label, going ahead and lipping if necessary. This is brand new, never been opened, so I don't need to lip. And I'm going to go ahead and pour half in here for a 50-50 peroxide rinse, wash, and then full sterile water for a rinse. Katie, am I doing okay?
I think so, Miss Palmer.
Okay. Then I'm going to go ahead and set these right out of my way. So I don't have anything in my way. I've got my field set up. I'm good to go. Now this is the part where students get confused often. And I kind of look at it like the analogy like dirty dishes. The trach that's in the patient right now is a dirty dish. So I don't want to put my sterile gloves on to touch a dirty dish. So I'm going to put clean gloves on. So I'm just got a regular pair of gloves off the wall. I'm going to put them on, and I'm going to go over there and get out that inner cannula to put in my dishwater.
Okay.
I don't need to be sterile for this. And this is, like, again, like I said, students often stand here and go, what do I do now? Remember, we got to get the dirty dish out, throw it in the water, then we can put our sterile gloves on to clean it.
Well, that makes sense.
So I'm going to move over here, moving the oxygens to the side just for a minute because Willie Make It needs it, Mr. Make It. And then I'm going to move my locking mechanism in the up position. And by the prongs, see how I'm holding the trach faceplate here? That's really important because as this trach moves, it can make the patient cough and it's very uncomfortable. So hold the outer cannula faceplate down and pull the inner cannula out, holding only by the prongs. I'm then going to place it in my wash bucket.
So that's the peroxide
Yes.
water combination.
Yes.
Okay.
The bigger area too. So you might see it fizz. This is good. This means we're cleaning it. You're definitely going to see some secretions in there. It really is good to see that. So now I'm going to remove my gloves. Remember, I'm going to be putting on a new pair of gloves, so I need to wash my hands in between. And because these are sterile gloves, make sure that you really make sure your hands are dry because they're going to be a little sticky. It's okay. The patient's okay to sit there. And the inner cannula is okay to sit there, so we're okay to take our time with this process. I'm going to put on my sterile gloves just like you've been taught a million times. Pinch and scoop. Pinching the first glove. Sliding my hand right in. Find your thumb. It always makes it a little bit easier. And now scooping here. I kind of push down with my knuckles and pull that up because it's going to be a little sticky. Let me just show you on the side here. How's that, Katie? Okay?
Yes, I think that's
So I
good.
push down on the side with my knuckles, and I kind of pull up so I can get all my fingers under there so I can keep them all sterile. And then I'm going to put my hand in. So the gloves are a little sticky at first. It's one size fit all, so just work with it. Remember, if you break the gloves, tear the gloves, or you can't get the gloves on appropriately, you should always think about having an extra pair of gloves, especially in clinical. Then you could just open those gloves and continue forward versus having to get rid of everything and start all over again. So now I'm going to be working in my container here. Remember, my hands are now what, Katie?
Sterile.
My hands are sterile, right?
Yes.
So I don't want to touch anything out here, only inside the bucket.
So can you touch the outside of this container?
No.
Oh, okay.
I can touch the inside.
Oh, yes.
I can touch the inside, but I can't touch anything on the outside.
Okay.
That would make me contaminated.
Right.
So only the inside of everything.
Okay.
So I'm going to reach in the inside here. I'm going to pull out my, it looks like something you would use for dishes.
Yeah.
Because I'm going to do my dishes now because my hands are clean. And I'm going to grab my inner cannula. I always use the prongs to hold on to it. I'm going to tip it upside down so I can work from bottom up. Do you know why I do that, Katie? Did Miss K&B tell you?
I don't know. Does it have something to do with organisms?
Yes. We're going to actually be moving the microorganisms down and out through the opening of the trach versus down and in towards the patient.
So kind of like your natural anatomy would do if you were coughing something up.
Yeah.
Okay.
Very good. So I'm just going to, and depending on the size of the trach, it's going to be a little bit tight to get this in here. I'm going to come moving this scrub brush in and out. Now in real life, right here will be a glob of secretions. Please remember to use your poker face here. Think about how the patient feels having those secretions and trying to breathe. You're here really trying to clean this as best as you can. You can dip in this peroxide water base here and clean around the outside. You really want to make sure you clean everywhere very thoroughly. And that looks pretty good. I'm going to drop this in my dishwater just because I don't want to risk contaminating by throwing it in the trash. So I'm just going to leave it right in there.
Okay, and that's okay because you're not going to use that again, right?
I'm not. Yep.
Okay.
And I'm going to go ahead and drop that in the rinse. And I'm just going to sit here for a minute with my hands above my waist and just let that rinse out a little bit. I'll even take it and just like you were rinsing dishes, I'll just take it, pick it up, and make sure it's thoroughly rinsed. Just putting a little bit of sterile fluid in there. Now your kit has these funnel cleaners here. You certainly could use to dry this, but a little bit of lubrication actually is going to help us slide this into the patient a little bit easier. Remember, we do have some fluid, not some humidification in the upper airway. So it's okay if this is slightly damp. We don't want it saturated, so you're going to give it a good shake. Please be careful to hold on to it tight when you shake it so you don't send it flying across the room. So you're going to give it a good tap. This looks pretty good. And I'm going to go back to the patient, remembering I'm sterile. I'm going to gently insert this at, I don't know, about an 8 o'clock position. Each trach is different. Some trachs go at a 9 o'clock position. Some trachs go at a 6 o'clock position. But I'm going to just feel how the trach, I'm going to let the trach move forward on its own. And then it'll drop down in place. Then I can close the locking mechanism. And now it doesn't matter if I'm sterile. So now I can touch whatever I want to. This is a great opportunity for me to clean the outer cannula's faceplate. So I'm going to go back to my container. Inside my container I have some Q-tips. I'm going to go ahead and dampen those. And I'm going to start cleaning around on the faceplate here. Throw that away. I'm also going to remove this, and really this should have been done first when I removed the inner cannula, so I apologize for that.
So anytime you're going to take that gauze off, you shouldn't have sterile gloves on, right? Just clean gloves? Okay.
Yes. So that's why it should have been removed when I took the inner cannula out. And then your kit comes with a split gauze. Remember, never split a gauze yourself because the frayed edges will actually end up in the respiratory tract, and I'm sure Ms. Canby told you that. To slide this up, I'm going to hold one side, slide one side, the opposite side. I'm going to hold the other side. Excuse my reach there, Mr. Make It. Slide that up. Again, trying not to manipulate this as little as possible because I don't want him to cough or be uncomfortable at all. Okay, Mr. Macon, I'm just going to put your oxygen back on for a second here, and I'm going to wash my hands, and then I'm going to change your trach ties for you, okay? So I'm just going to take my gloves off and wash my hands and get rid of my equipment, just because my hands are pretty gross from cleaning the secretions off the trach, and I don't want to touch his neck and things like that. So I'm going to go ahead and remove these and wash my hands. Let me just get rid of my items over here. Okay, I'm all clean, and now I have my trach ties. Again, washing my hands. Okay, Mr. Make It, I'm going to go ahead and change your trach ties. In order for me to do this, I'm just going to have somebody else come in and help me, just so I can have them hold one side while I feed the other side through. So, Miss K&B, would you be available for assistance?
Sure, I sure can come and help.
What size glove are you, Miss K&B?
I'm small, Miss Palmer.
There you are.
Thank you.
Okay. Again, this is a very uncomfortable process for the patient because it moves that outer cannula around. So just make sure that the patient understands you're just going to change the trach ties. You'll try to go as quickly as you possibly can and make it as less uncomfortable as possible. We're just going to take that little button off. Trach ties come right out of this. They're Velcroed, so they're adjustable, and I can adjust the width of it as well around the patient's neck if I need it to be shorter or longer. Shorter or longer. So first thing I'm going to do here, Miss Canby, is I'm just going to lift his head up and slide it over to you.
Okay.
Okay, Willie, just real quick here.
There we go.
Good. And you've got your Velcroed side?
Mm-hmm,
excellent. Yep. So I'm going to go ahead and hold my side down because remember, the only thing holding this trach in place are these trach ties. So I don't want to remove the Velcro and the patient coughs and the whole trach can come out. So I'm going to go ahead and hold the faceplate down and have Miss Canby go ahead and remove her side and put the new side on. And she doesn't want to lift it too much, but she can lift it a little. And sometimes this is easier to do with the 2x2 not in place, so you can certainly do it ahead of time. because it kind of sticks to it. Then Miss Canby's going to hold her side down. Thank you. While I do my side. This is the dirty one. I'm going to pull it right out and slide the clean one in. These are then date, time, and initialed so that everybody knows when they were last changed. They're not changed every day. They're usually changed weekly or sometimes twice a week. Oops, can't grab a hold of it. Depending on the institutional policy. So just check your policy guidelines. Sorry, Miss Candy. I know I'm pulling a little bit. There, and that trach looks excellent. Miss Canby, can you just button that trach collar back in place for me?
Sure.
Okay, Mr. Willie Make It. You're all set. Your trach care is all completed. Is there anything else that I can do or get for you before I leave today? Great. You have a good afternoon.